Hi everyone, my name is Juliana Rambridge Perez, and I'm here because today I'm going to be speaking regarding systemic lupus erythematosus. And I would like to welcome you guys all. I am an LVN myself, and I know you guys are going to become LVNs soon. I would like to ask you guys if you guys know what lupus is. I do. Okay, good. Well, first I would like to explain to you guys what the signs and symptoms are, what is lupus, and the treatment. What lupus is known as the great imitator because it imitates other diseases. It's an autoimmune disease that will affect your body. So our body makes an antibody, the protein that we have in our blood, and it fights against germs and cancer and invaders that we have in our body. But what happens with the lupus, it attacks your body, it attacks itself. With patients with lupus, they can have flare-ups. It could be from mild to very severe, and when it comes severe, they have to be hospitalized. They do need treatment. Who has lupus? Well, the majority of people who get lupus will be females. That doesn't mean that males won't, but females are like more susceptible. This is just an example of Selena Gomez and Seal. Those are celebrities that actually have lupus.
Oh, wow.
And some of the signs and symptoms for lupus, it includes the skin, the heart, stomach, blood, muscle, lungs, and kidneys, and sometimes it affects hair loss. With the skin, one of the main signs is the butterfly rash that appears over the nose bridge and over the cheeks. It turns into like a butterfly shape. It's red. And for the heart, it affects the lining of the heart. So one example is endocarditis. And for the abdomen, it can cause nausea, vomiting. It upsets the stomach. And for the kidneys, it could affect the kidney by having high blood pressure and retaining water in the body. For the lungs, it affects the lining of the lungs. So when the patient tries to take a deep breath in, it hurts them when they take deep breaths. For a muscle and joint, some of the symptoms will be joint pain, and they'll get like flare-ups in their joints. And also for some have hair loss. And also they get headaches as well. Causes and triggers for lupus could be genetics and environmental. It attacks the healthy tissue, like I said earlier, and it could be caused by stress. And some of the potential triggers are sunlight, infection, and medication. If a patient might be taking a med and all of a sudden they get diagnosed with lupus. Some of the treatment for lupus will be NSAIDs, and that will include ibuprofen and naproxen, and anti-malaria drugs that would include plaquenil. It's like the #1 treatment for lupus. The immunosuppressants will be Imuran, Cytoxan, and Neuro or Sandy Immune. And for the biologics, it could be Orencia or Rituxan. It's an infusion treatment. Or it could be just a combination of treatment where the patient is placed with prednisone and plaquenil. That's like the main one, or methotrexate. Another treatment they normally do at the beginning. And I hope you guys learned something from this presentation. I hope you guys we're enlightening about what lupus is, and hopefully you guys know what lupus is, some of the signs and symptoms, and what the treatment can be. I want to thank you for being here and being part of my audience for my English class. Thank you.